So how does a consultation for a breast augmentation go at our office? Well, first of all, before you even see me, what we're going to do is take some photos of you. This is a very special camera called the Vectra system. Helps scan your chest so that we can actually play around with different profiles of implants and sizes during your consultation. After the pictures are done and processing, then you're going to actually meet me in the office. And the first thing I do, besides, of course, talking about, wish pics and what your desires are, what size you want to go, is we, of course, do a physical exam, meaning I measure everything. This is what I trust the most beyond all the technology. And of course, I try to use every modality to allow you to sort of pick your implant. I never pick the implants for my patients. My job is to guide you. So what does that mean? It means using sizers. So you actually get an idea of how things are going to feel, how much the implants roughly weigh. Of course, these are the implants themselves. We work with different companies in terms of what implants, what profiles that you're looking for. And of course, the highlight, besides trying out the sizers, is the Vectra 3D system. I'll take you over here. After the actual pictures have been processed, what we usually like to do, of course, is go through the Vectra system. You can even put a bra on, look at different views, different profiles of implants, what your cleavage is going to look like. And really the highlight of this entire system is that 99.9% of the time, I'm going to give you something much better than what you see on the screen here. But we combine measurements, sizers, and of course 3D imaging to allow you to really get a better idea of what to expect after surgery and guide you into that process to pick your own desired implant. So in terms of the Vectra imaging, the highlight, I think, of your consultation, we're able to really look at before and afters in terms of expectation. Remember, 99.9% of the time, I'm going to give you something much better than what you see here, but it's a conversation piece. Gives us an idea in terms of profiles, looking at how much upper pole fullness you're looking for, how much cleavage you're looking for, how natural of a look or how augmented of a look that you want. And of course, playing around with different sizes and views of the surgery so that you can predict your results.